our Unclenched podcast. Today we'll be speaking to an ENT, ear, nose, and throat doctor, also called otolaryngologist, that Dr. Alex and I met at ICMO in Denver a few months ago. His name is Dr. Manan Shah. Before we bring him on, though, I need to get caught up with my Alex. What's new with you?
Hey, Priya. Oh, just a lot happening. Last night, for instance, I was talking to a local dental study group, and I did talk about upper airway. So it kind of segued into what we were doing. So I did mention everything that we're going to be talking about today. And it's just really neat to get together with doctors, and a lot of them just don't even know what I do or what neuromuscular dentistry is. So there were a few good questions, and I just really, really enjoyed it. But sometimes you get in front of a group and they're kind of dry, and I'm making these little jokes, and I'm like, oh my God, these people don't even get me. Like, what do I do? But it all ended up out nice, and it was a nice group, and that's kind of about it. Oh, one other thing, my daughter, who is in dental school, she just had an interview in Denver for a general practice residency program, and she really liked it. So fingers crossed that she has 3 interviews in the Denver area. So she wants to go there for a year or so, and then hopefully she comes back to me, but I don't know. We'll see.
I know.
So what's going on with you?
We just got back from a family trip to Mexico. So it was
Nice.
it was really fun. It was really warm and but really humid. It was like a little too hot for me. So I'm glad to be back in my rainy Pacific Northwest. But it was my husband's dad's side of the family. So my husband's dad has 5 siblings.
Wow.
They all came.
Wow.
Yeah. It was really fun. So and they're just like the nicest people. Like I even asked them individually, kind of was like, so who fought growing up? Like, give me the dirt.
Yeah.
They never fought. None of them.
Oh my gosh.
I know, they're peaceful people. It's the state where Gandhi comes from, right? So
Right.
they're peaceful people. So I was like, oh, okay, no dirt, but they're just so nice. Their kids came and their kids' kids. So it was like my kids got to play with their second cousins and cousins.
So how
and
many people were there in total?
41.
Wow.
Yeah, and we got shirts that said mysteries make history.
Ah, how
It
fun.
was fun. It was cute. It was really fun. So yeah, that's what's new with me. But tell me, Alex, is there a patient that stuck out in your mind for these last few months? Tell me about it.
You know what? There always is a couple patients, but I did have this one guy that I've been working with from Columbus. He drives in from Columbus, and terrible ear ringing and a lot of anxiety, and doesn't take meds for them or anything, but he sometimes patients, like, you tell them something, but then they've got to figure out things on their own. So then they go to a chiropractor, then they go here, then they go there, and I'm like, let me drive the friggin' bus. So I gave him an SPG block. He's like, can I come see? It was on a Sunday. He's like, can I come down? He was like really anxious. And I'm like, okay, fine. I'll meet you at my office. So I gave him an SPG block at my office, and he's like, my air pressure is gone. I feel so much better. His anxiety was down a lot more. So I was so glad that I went in, and I'll go in anytime I'm in town. And if somebody needs something, I'll go in, no problem. But he made the 3-hour drive in that day. And then I saw him a week later, and he's like, I'm so much better. I said, will you just let me be in charge? Because if you don't, then you're going to go off the deep end again. But that was a pretty interesting one for me. And it all worked out so well.
Yeah. Well, I'm so
glad.
You? I've been using DTR a lot more, disclusion time reduction therapy at my office.
So I've heard. Little birdie told me.
Was it Dr. Sutter?
Yeah, he told me. He's like, yeah. Priya's hitting it. I'm like, yay,
oh my Priya, gosh. I text him every day, and I think he's so nice about it, but I'm like, I know I'm being annoying, but I have so many questions.
I know
Like,
it's okay. That's the only way you learn, and they're
it's the only way. And
he's so gracious.
he's
And
so nice. And I told him we're besties now. He's stuck with me. But
yeah, yeah, I
yeah, so
know. I
really,
know every time I talk to him, I'm like, Ben, remember I love you.
I know he's so nice. He's so nice.
He really
Um,
is.
so yeah, so
He
I've
is.
had some really great success with DTR. It's interesting because after we do that therapy, there's a rebound, right? The
Yeah,
teeth kind of
sure.
move back. So there are some patients that have had to come back a second or third time, and so that's been kind of interesting to see. There are some that are one and done, which is amazing, really, if you think about it. And then there's
Mhm.
some that I'm going to be seeing for the second and third time.
Sure.
So yeah, it's exciting. But let's go ahead and segue into our guest.
Absolutely.
So Dr. Manan Shah, ENT, we're so happy to have you.
So happy to be here with you guys. Thank you so much for having me.
Yeah, of course. So Dr. Shah, the reason we're having you on is because your presentation at ICMO just blew us away. It was captivating, and Dr. Alex and I immediately saw what you do can help many of our patients. Many of our TMJ patients suffer from allergies, enlarged tonsils, enlarged adenoids, etc. And all of this can affect orofacial development from a young age, which can then lead to TMJ problems at a later age or even at a young age for some of these people. So I think Dr. Alex and I were both excited about your company, what you're doing, how you can help our adult and children patients that we work with, including my own. So, why don't you share a little bit about your company called Wyndley?
Yeah. So, guys, I'm Manan Shah. I'm an ear, nose, throat doctor. I have 2 offices here in Denver. And during the pandemic, we took our practice and we went totally virtual because people were a little bit worried about coming in to see us. And the only thing an ENT can really do totally via telehealth is allergy because it's a history based diagnosis. And so we love working with neuromuscular providers like you guys because look, the nose is here, the mouth is here, and the airway is just literally connected. And if we don't work together, these patients aren't going to be able to breathe well, sleep well, and feel better. We know that the number one cause of nasal obstruction is allergies, and that's why ENTs got into environmental allergy, right? Of course, we can do surgeries. I've still got my surgery cap on. I'm actually at the operating room today. But what we always want to try is a natural solution to try to help them breathe better and fix their nasal obstruction, by fixing their allergies. If that doesn't work, of course, we'll do surgery. And so we started focusing on allergy in our practice. And during the pandemic, we started doing it totally virtually. And part of the reason we've had such a great experience working with neuromuscular providers is now we're able to put our allergy test kits into neuromuscular providers' offices, and then the patients can get tested, and then our providers can see them directly and start taking care of it. So what we do is we focus on what's called allergy desensitization. We essentially give you a small dose of what you're allergic to, and it's tailored specific to you. It looks like this, and you take it under the tongue each day. And over time, as you expose your body, you become desensitized. This is actually the same medication as allergy shots, but it's given to you in a drop format. And that drop is tailored and prescribed by a physician specifically for your allergies. And so, Wyndley, which is the name of our telehealth practice, we see patients in all 50 states. We're able to test people in all 50 states, and we're able to have physicians meet with you virtually online, figure out what your allergy triggers are, and prescribe you a custom allergy treatment program that's going to desensitize you to your allergy triggers.
Wow. So, Dr. Shah, can you share about your personal experience
Yeah.
with allergies and immunotherapy?
So I actually am, of course, so I'm deathly allergic to cats, or I was deathly allergic to cats. And of course, I fell in love with a woman who loves cats probably more than me. And so during my surgical residency, I went over there and, I'm this young Indian boy courting this very Massachusetts, like Portuguese, woman. And I'm trying to, make a really good impression on her parents. And it turns out her parents had a cat. And this is something I didn't know because she didn't think to tell me because the cat had died. But I, of course, used a cat blanket that the cat had sat on, and my eyes swelled up, and it looked like I'm seen from the Nutty Professor. My eyes were swelling, my face was swelling, my lips were swelling, and so this first impression of me with her parents was them rushing me to Mass Eye and Ear so that I
Oh,
could, get treated. It was it was a wonderful first
my.
impression, and I'm surprised they let me marry her. And so that was when I realized I had to do some sort of allergy treatment. And I knew that the traditional treatment is allergy shots. So I asked my program director in my training program if I could get an hour off a week to go do allergy shots. But in residency, it's we're pretty busy, right? And so we always are looking for ways to not be around. And so thankfully, some of my mentors there did this thing called sublingual immunotherapy. They did the drop thing. And I was like, how come I haven't heard about this? And like, well, this is what everyone does in Europe. We do it at all the academic centers. but it doesn't reimburse as well. So you're just not going to see it out in private practice. And that like just absolutely struck me that you had to, that this method of care is just driven by like what the insurance companies decide to reimburse. So I did the drops myself, really helped with my cat allergies. Now I can go spend the time with people with cats and not turn into a crazy looking person with swollen eyes. And when I started my practice here in Denver, we started doing it locally and people absolutely loved it. They loved that they could take their medications from home. They loved that they didn't have to do all their visits, in the office. They loved not having to get shots. So busy parents or people who have needle phobia, they loved it. And then during the pandemic, we realized like, hey, if we can do this virtually in Denver, we might as well partner with other physicians and do it virtually across the nation. And that's how I ended up meeting you guys through ICMO.
That's
Nice.
awesome. How did you, I know this is a little, we didn't discuss this earlier, but how did you find out about ICMO?
Oh, yeah. So we have started working with neuromuscular physicians locally. We work with neuromuscular physicians because when someone comes in to see me and they have bilateral ear pain, it's almost never actually an ear pain issue. It's TMJ. But we also started realizing that providers like you guys are focused on the airway. And so patients that come to us that are focused on the airway, we can fix everything here, right? We are great in the nose, but we need a partner. We need someone to help us focus on the airway and developing their jaw and making sure that they don't have TMJ and making sure they have enough space to breathe. And so we love this sort of multidisciplinary approach. So we
Cool.
started working with airway providers, and that's how we were introduced to ICMO. And
Got
so I
it.
gave, I think, an initial virtual talk, really enjoyed meeting the other providers. And then I was like, I'm going to come do this in real life so I can actually connect with these providers in real life.
Really cool.
Great.
Well,
Great.
can you break down exactly what immunotherapy is? So I've had your flyers in my office for a while now, and people will ask if it's medication like Benadryl or Allegra for allergies. And they're like, well, I don't want to take meds. And so I'm like,
Yeah.
well, it's different from that. So I wanted you to explain it.
Absolutely. So when you're exposed to pollen, if you have a pollen allergy, it goes in your nose, it binds to cell, and that cell releases histamine. And histamine is a vasodilator, meaning it makes your blood vessels dilate and get big, and that makes your nose stuffy, runny, sneezy, watery, and miserable. That's why people take antihistamines. And if you take an antihistamine, what it does is it blocks that histamine from being released for about 6 to 8 hours. So Claritin, Allegra, Zyrtec, Benadryl, these are all antihistamines. They're going to work great for 6 to 8 hours, and they're fine, but they cross the blood-brain barrier, so they sedate you. They have some concerning side effects, and they're not a long-term solution. And so the long-term fix to allergies, if you want to do it in a more natural way, is to retrain your immune system, right? I think it's kind of silly that people's immune systems would be scared of trees or grasses, right? We live in a world filled with trees and grasses, but because of the way we are, live now in modern society, sometimes our immune system doesn't get enough exposure when we're a kid. And so we like to think of immunotherapy as a way of like going back and giving you that natural exposure in a small dose for a prolonged period of time. And what happens is your immune system starts to learn that like, hey, that cat, I shouldn't treat that the same way I treat, anthrax or parasite. I should treat that cat like a normal animal that humans have, evolved with for maybe 30,000 years. And so that's what this is. It's exposure therapy. What it does is it retrains your immune system to make blocking antibodies. So traditionally you have pollen, and the pollen binds to what's called immunoglobulin E, which is an antibody that releases histamine, and the histamine makes you feel terrible. But what happens with the immunotherapy is you have this repeated exposure for about 3 years, and you start to make other antibodies. So then when you see pollen, the other antibody binds to it, it never releases histamine, and you just never have the symptoms. So what I tell
Wow.
people is like allergy medications like Claritin Allegra, they're short-term solutions. They're a Band-Aid.
Yeah.
This is fixing the root cause. Now, there is a traditional way of doing this using allergy shots, which is, again, a once-a-week shot in a physician's office. Works great. However, for many patients, that's just not convenient. And in today's world, people don't have time to go sit there for an hour every week.
Yeah.
Yeah. So, Dr. Shell, how long are people usually in treatment with this immunotherapy?
Yeah, so immunotherapy, when it's done by shots, is like 3 to 5 years. When it's done by drops, the treatment protocol is about 3 years. So it's a little bit shorter if you can take it at home because you can expose yourself a little bit frequently. And we found really good outcomes at about 3 years. And so we
Wow.
start people on immunotherapy. Within 3 to 6 months, they start to feel better. They start to notice they're using less antihistamines. They're having less days with stuffy nose, runny nose.
Nice.
For our
Nice.
neuromuscular providers, they start to notice that their oral appliances stay in longer because the patients aren't spitting it out at night. And over time, patients start to notice a subtle improvement. And then at the end of 1 year, they start feeling better. And then at 3 years, they start feeling even better. So I always tell people, look, this is like braces or an oral appliance or many things. It's not something that you put them on and right away you feel better. It is an investment in your health, but it's retraining your immune system so that you don't have to take pills and sprays for the rest of your life.
So let me ask a question here. When they're taking the drops, can they also still
Yes. Yep.
they can still take their
Yeah,
Zyrtec or
they
whatever over
can.
the counter?
Yep. And so many of our patients will take it for about, 6 to 8 months. But
Okay.
generally, when you work with us, our providers are able to check in with you. We have unlimited visits through our plan. And our providers will start to try to nudge them away from that safety blanket at about 8 months because these are patients who are just so used to taking an Allegra every day, and we'll say, hey, let's just see how you do without it. Now, sometimes you have to go back on it, but at about a year, most of our patients are starting to drop their
So
antihistamines. At
cool.
2 years, they're feeling way better. And the goal is at 3 years, they've significantly decreased their antihistamine usage.
Wow.
Are there negative side effects for taking something like Allegra or Allertech like long term?
Yeah, so we don't know. I think in general, they're pretty safe, and that's why they're over the counter. There are some studies that have been concerned that they're because they cross the blood-brain barrier, that there might be some sort of long-term dementia risk or Alzheimer's risk and things like that. To be candid with you, the data in those studies is hard to read, and so it's hard to know if this is causation or correlation.
Mm, okay.
What I can say is these medications are sedating. They are not solving the problem.
Yeah.
And for many patients, they can actually have a paradoxical excitement. So some people take Allegra and they feel almost like too energetic and it can affect their sleep in a different way. And so we
Mhm.
love this idea of just naturally retraining your immune
Yeah.
system because it's far better for your immune system to not get scared of dogs or trees or grasses. That just makes much more sense to me.
Yeah, totally. I mean, I take Allertech every day during the summer and then every other day for the rest of the year. I mean, it's stupid.
Yeah.
Like I don't want to keep taking it. But
Yeah.
beyond that, can kiddos get this treatment? Is there like a minimum age or weight
Yeah.
that the kids have to be?
So we start children at 5 years and up. Before 5 years, it's hard to know, like their body still changes. It's hard to know what their real
Sure.
allergies are. At about 5 years, we can start them on sublingual immunotherapy. And most of that is just because the data and the studies have been on kids 5 years and up. The beauty of taking it in kids that are young is allergic rhinitis or allergies. If it causes inflammation in your nose, that allergies and inflammation is going to drip down the back of your throat as a postnasal drip and cause what we call reactive airway disease. That inflammation in your lungs ultimately turns into asthma. So these kids, they start at 5 or 6 with allergies. By the time they're 10 and 11 and 12, they're getting asthma attacks. And then eventually they start getting eczema in their 20s. It's
Mhm.
what we call the allergic march or the atopic march. And so
Yeah.
if you can stop that, if you can cut it off at the pass, their airway develops appropriately. And then you guys can probably tell me more about what happens when these kids have this nasal obstruction at a young age. Their oral cavity doesn't develop normal because their mouth
Right.
breathing. So they get teeth flaring and cavities and then they clench and they get TMJ and they end up in your guys' chairs.
Mhm. Yeah,
Right.
totally.
Wow. Does the treatment work for food allergies or is it just the environmental
Yeah.
allergies?
So right now, because we're telehealth, we're focusing only on environmental.
Okay.
There is oral immunotherapy for food that you can do in some patients. And there's one FDA approved medication called Palforzia, which works for peanuts. And so we can do that in a physical office, but
Mm.
virtually we want to keep everything safe. And so with food, there's a high risk of what we call anaphylaxis, which is a bad allergy reaction.
Yeah.
With environmental allergies, the risk of, having a bad allergy reaction with these drops is about 1 in 100 million. We've not treated 100 million patients and we've not had anyone have a consequence. So it's super unlikely. We always give people an EpiPen just in case.
Oh,
But
okay.
essentially, when you look at the numbers, 80 million people suffer from environmental allergies. Between 10 and 15 million suffer from food. We want to take care of the biggest number of patients first, and then we'll advance into the next treatment once our company gets a little bigger.
That makes sense.
Yeah. And I know you've touched on this, you've already gone over it, but I just wanted to make it very clear. How does immunotherapy work, your company
Yeah.
versus allergy shots?
Yeah. So allergy shots, a great traditional treatment. We even do them in our physical office here in Denver. You come into an office, you get a weekly injection. You have to stay for about 30 minutes afterwards to ensure that you don't have a reaction. And you do that once a week for about 5 years, or 3 to 5 years, depending on your treatment protocol. And some protocols can be faster, shorter, but I'm talking in generalities. The
Yeah.
benefits of that is it can be covered by insurance and it does work for venom, which is great. And sublingual immunotherapy doesn't work for venom. So allergy shots have a place and they're a great treatment. But in today's world, it's really hard for me to convince someone to come into my office once a week, right? People have other
Yes.
things to do. They have swim lessons, they have band, they have dense and like parents are just not going to do that. People are traveling. And so sublingual immunotherapy just works better for busy families. You can take this drop from home. We basically have you take it every morning, take 3 drops under your tongue. It's small enough that you can get a cap, put a cap on it and travel with it if you're traveling.
Nice.
And it's easier. You don't have to get a shot. You just take your drops and go on with your day. You leave it under your tongue for about a minute. And also, the benefit is when you're doing allergy shots, you need to get what's called skin prick testing, right? They stick you 40 to 60 times in the skin. When you're doing sublingual immunotherapy, you can actually use blood testing because you're not going to be, doing a shot. You don't need to know how the skin responds. You just need to know what the allergy triggers are so you can personalize the prescription. So that's where we work with providers like you guys. We'll allow you guys to do the allergy blood testing in the office and then pass the patients on to us, and we can then, work with the patients directly. But it's just a great opportunity for you guys to be the hub. You're talking about earlier, like you want to drive the bus for your
Yeah.
patients. You want to be the one who's in charge because a lot of these patients, if their airway is in trouble, you guys are the experts. And we want to be sort of the spoke off your hub. We want to be a supporting specialist for you guys where we can help with this part in the nose while you guys drive the TMJ and the airway and all that type of stuff.
So let me ask you about something there when you're talking about the airway. So you're an ENT, so of course ear, nose, and throat. And in my office, we're always talking to patients about decreasing the inflammation in their airway, nasal breathing, nasal exercises, lip taping. Do you go over any of that to help like decrease the inflammation in the nose and in the airway, the upper airway?
Yeah. So all that, look, I always joke with people that this whole structure, this massive thing that's in the middle of your face, it was there, it evolved because you're supposed to breathe through it. This is for eating, this is for breathing. There's turbinates, there's nose hairs, there's mucus, there's all sorts of defense mechanisms in it. You want to keep that area clean. So things like nasal sprays, things like topical nasal steroids when appropriate, and then even nasal, like trying to breathe through your nose as opposed to your mouth. Some people will use lip taping. All those things are really important. Our focus, of course, is on how can we fix the problem that many people have that they don't even know they have, right? A lot of people, they're just like, I'm always stuffy. They don't realize it. Well, 80 million people have allergies. As the climate is getting warmer, there's longer pollen seasons. And so more and more people are suffering from allergies. And we want to at least give them the information that they might have an allergy that could be contributing to it in the most simple way.
Yeah. So have you treated your own children for this? And how old are they? And what's going, how's it going for them?
So interestingly, my kids don't have environmental allergies. They didn't get
What?
those genes from me. They got it from my wife. Yeah, it's crazy. They're like never stuffy. They never got ear infections. I never had to put
I
them on
love that for
antibiotics.
you.
It's incredible. But we did actually treat them with my youngest daughter. She has what's called retromathia. So she has like a small jaw, and she's in an expander. She's in a device, and it's been great because her sleep has gotten better. We think it's probably helped with her school because she's getting better restful sleep. It's definitely helping with her cosmetics because her teeth were like all crowded. And we used to joke, my wife and I, that she's a snaggletooth, and don't tell her I said that. And hopefully she won't see this podcast. Now they're starting to move. And so I'm like, she's going to be a beautiful, wonderful young woman. But I felt bad for her before that, she got my little Indian jaw.
Yeah.
Yeah. Well, my daughter, same thing. She's in treatment right now, and we're seeing a difference already. Instead of walking around with her upper teeth resting on her lower lip, she can get a lip seal for a lot of the day now. I mean, that's huge, and it's going to do wonders for her self-esteem because it's cute now, but in like 5 years, I don't think she's going to think it's that cute, right?
No, exactly.
So yeah, the aesthetic part of it, the airway part of it, the orofacial development, everything. It's like it's amazing. But anyways, this has been a lot of great information, Dr. Shah. Thank you so much for coming on, taking time out of your busy day. Thank you, and sharing your
this is
knowledge.
awesome. Yeah, guys, we really appreciate the opportunity to work with neuromuscular providers like you guys.
Okay, one more thing. Is it
Yes.
true that Denver is like the city with the most allergens?
I actually think it's North Carolina, but that's sort of our personal data. They've got a ton of, I mean, Denver has a ton of allergens because we get, some of the mountain cedar, and we also get ragweed from the plains. Interestingly, traditionally we used to say that, look, there's no dust mites in Denver because at the altitude, there's a lot of humidity, and dust mites start having humidity. I still am seeing it in some of our patients. I wonder some of it is because everybody in the world, including your daughter, is traveling and moving to Denver. But I do think that, as things are changing, there are some more damp, humid basements. There's more leaky pipes. There's more, just the environment changes. And so just like
Sure.
we're seeing pollen seasons are getting longer and worse every year, we're starting to see allergens we didn't expect in places that they shouldn't be.
What
Oh,
about
so interesting.
it's so
So
interesting.
interesting.
Where does the Pacific Northwest like fall into that? I know that's like a
Oh my
broad
gosh.
region.
Yeah, no, but so you guys have a ton of mold allergies because there's
Okay,
so much humidity.
sure.
You certainly had tree, grass, and weed allergies because everything grows there. But I think that the mold allergens are a really interesting thing that you guys have that, again, not huge in Denver because there's not a lot of humidity, but like Florida, Louisiana, Pacific Northwest, that humidity, that dampness leads to the,
Mhm.
the leaves and stuff kind of growing mold spores and they get into your air ducts and they cause irritations sort of year round. So when someone says like,
Interesting.
I feel like I have allergies all year, I'm thinking mold and dust mite. I'm not really thinking like tree and grass.
Mhm.
Interesting. I'm very curious because I just sent in my tests
Oh
and
yeah, I know.
my
See
kids
it.
and husbands have been sent in for a while. So I wanted to get together with you and talk about all four of us because we're all a
Yeah.
mess. So I'm
Yeah,
looking
I
forward to
know.
that.
And I was telling him, Priya, before you came on, that I'm getting mine too shortly. So then I'm going to
Mm.
be sending out and seeing because it's just certain times of the year I
Mhm.
have like the itchy eyes and the runny nose, and then it goes away. And I typically don't take anything once in a while as
Yeah.
Zyrtec. I'm just too lazy to take something regularly.
Yeah.
And, but I would like that to just go away. So I know
Yeah.
there's something that's bugging me, but oh my gosh, thank you again.
Thank you
We
Yeah,
so
had a
guys, this
great
is
much.
awesome.
time, so informative,
Mhm.
and I can't wait to work more. Can't wait to work more with you guys and see how this does help our patients, kind of bring it all together because there's so much we can do, but with neuromuscular dentistry, we always try to get to the root cause and not
Mhm.
band aid it. So, this is another way I think Priya and I will definitely use with our patients and hopefully a lot of our colleagues to get them to get to the root cause of the nose stuff because we need that lip seal. We need that tongue to
Mhm.
the roof of the mouth, and we need people using their noses more.
Mm.
Sounds
I know.
awesome.
It's gonna be awesome. I'm so excited.
Thank you
All
guys so much.
righty.
I appreciate the
Thank
opportunity to work
you.
with you guys.
Okay, thank you. Bye bye.
Thanks, Doc.